It's Mari McInerney from Croaky here at Safer Care Victoria's Giant Steps Conference in Melbourne, and I have a keynote speaker, Lyn Swinburn, here. Lyn, could you introduce yourself and your roles?
Sure. So I'm Lyn Swinburn. I'm a mother, a grandmother. I'm a breast cancer advocate, I suppose is one way of describing myself, and I'm also now a person who sits on multiple boards.
Thank you. Now, you talked about that journey, and it was quite a journey, and the most noticeable thing for me was that sense that you had very much back in the 80s of being a patient without a voice in an issue that was yours. Can you talk about what that felt like, and how hard it was to build that?
It's in exactly the correct way of describing it, that I was without a voice. And I'd had confidence in myself before this, that if I wanted to do something or achieve something, I could make it happen. But it felt like I was out of control with this. I needed information, I couldn't get information. I needed someone to help guide me through the system, I couldn't get that. And I was angry because I was given my diagnosis over the phone by the doctor's receptionist at playtime when I was teaching school. And it's always awful getting terrible news like that, but actually getting it in that setting somehow made it so much worse. I was not prepared, and I had no one there to help me deal with that. And so I got angry and I got frustrated, and the more time I spent in doctors' offices and doctors' waiting rooms, the angrier I got, because I could hear conversations with other women. I was thinking, just care for her, just look after her, don't keep telling her how grateful she should be that she's alive. And so because I'm a bit of a loudmouth, I shared that with a lot of other people, and women came out of the woodwork, women who'd experienced similar things to me, or far worse in lots of occasions. Women who were my friends, who had mastectomies and never told anyone. I didn't know. It was sort of shameful almost. So in my naivety, I thought it would be easy to say, hey, it's not working for us, we need to lift our game. I hadn't realised that actually what I was really needing to do was change a whole culture and a way of approaching a whole situation.
And how would you characterise that change that you've managed to achieve?
I think what has happened is that the medical profession and the scientists and the politicians, all of whom play an important role in this, understand now that they're dealing with women within their own social context. So we're not just a tumour on legs. We need to think about recovery. So it's no use getting through all the treatment and being crushed as an individual. So it's the need to walk along this journey with us and help us get through it in the best possible way.
Now, you're now on the board, you're chair of the board of the Royal Women's. What is it like being on the other side, and how does your experience inform that position?
Yeah, well, it's very interesting being on the dark side, if you like. I am much more mindful of the challenges for the clinicians and for the hospitals and for the whole system in delivering what I would think as best care. But I'm very proud to say that at the Royal Women's Hospital, certainly not just because of me, but we really do focus on a woman in her social context, and all the systems around her that need to play. It's not always easy because we have to prioritise. There's limited funds, so where are we going to put those funds? It's a big challenge for me, but it's also an amazing privilege to think that I'm in a position to really influence decisions made on behalf of the women we care for.
What advice would you give to people who need to bring about change, because there are still so many parts of the health system that hurt people?
Yes.
What's your advice?
I think the hospitals are way better now at listening to complaints. I know at the Women's, we actually welcome complaints because we recognise it's a way that we can get a better service. So most hospitals have consumer representatives or advocates or something. I would really encourage you to go to those places and give them feedback. Give them positive feedback as well, but really give them feedback. And then I'd encourage also you follow it up with a written letter. It's amazing how often I say to patients, I grab people in lifts and say, how, is this your new baby? How was it? How did we perform? How did the hospital perform? They haven't got a clue who I am. And they always say, oh, it was amazing, we're so grateful. And then when I scratch below the surface and I say, well, did you have the information you needed? Was there continuity in your care? Then things come out and they say, oh, could have done that better. And I say, please write and tell us. So that's the one thing I would encourage, and everyone can do that.
Fantastic, Lyn. Thank you very much for your time.